Nobody at the VA hospital knew the quiet trauma nurse had spent 6 years diving into freezing black water to pull strangers back from the edge of death. She took the jokes. She took the doubtful looks. She let a young doctor correct her in front of a room full of people. Then the man who pulled her out of a homeless shelter when she was 11 years old, the man she calls her father, is wheeled and dying, and the diagnosis on his chart is about to kill him. She has one choice left: stay invisible, or become, one more time, exactly who she really is. Welcome back to Secrets of Silent Badges. Before we start, drop a like, tell us where in the world you're listening from, and hit subscribe. Because you never know which nurse, which soldier, which quiet person next to you is carrying a story like this one. You're doing it wrong. Emily Hale didn't look up. She kept her hand steady on the IV line, taping it down in one clean motion. Dr. Reyes, the line's fine. I didn't ask for your opinion. I asked you to flush it and step back. Reyes was 29, fresh out of his residency, still wearing his white coat like it was armor he hadn't earned yet. He liked being watched. He liked being right, especially in front of an audience. Emily flushed the line. She stepped back. Behind her, a first-year nurse named Priya mouthed sorry, like it was her fault. It wasn't. Emily had been at Coastal Ridge VA for 3 years, and in 3 years, she had learned exactly how much of herself to show. Not much. Enough to do the job. Never enough to be seen. The trauma bay smelled like antiseptic and cold coffee. Fluorescent light buzzed low over 4 empty beds. Beyond the sliding doors, an ambulance bay sat quiet under gray morning sky. The kind of gray that never fully lifted this close to the coast. A radio on the counter played low static between the local weather report and a call for a fender bender 3 exits north. Nobody paid it any attention. Mornings at Coastal Ridge moved slow until they didn't. "You've got good hands," Reyes said, like he was doing her a favor. "You just need more confidence. Nurses second-guess themselves too much." Emily said nothing. She'd learned that silence didn't invite follow-up questions. Talking did. She wore her hair in a long, dark braid, the same way she'd worn it since she was a teenager, since a woman on a rescue boat had shown her how to keep it out of her face in rough water. Bright blue scrubs, sleeves pushed to the elbow. A thin scar ran along her jaw, pale and old. The kind of scar people assumed came from a car accident. Nobody ever asked. She never told them. Her palms carried a different kind of scar. Rope burn, deep and permanent, the skin slightly raised in 2 parallel lines across each palm. She kept her hands busy enough that no one looked too closely. Behind her left ear, hidden by her hairline, there was a small dent in the skin. Divers called it barotrauma. Most people who saw it assumed it was nothing. "Bed 4 is ready for the 8 a.m. admit," Priya said, mostly to break the tension. Emily nodded and moved past Reyes without a word. She liked mornings. Mornings meant paperwork, medication rounds, blood pressure checks. Mornings meant nobody's life depended on the next 90 seconds. She had learned the hard way what it cost her when somebody's life did. Down the hall, an older veteran named Walt Dabrowski sat propped up in bed 6, a regular, in for his 3rd round of cellulitis that year. He liked to talk. Most staff avoided lingering near his door because his stories ran long, but Emily always stopped, even for 30 seconds. "Morning, Walt." "Nurse Hale." He said her name like a greeting he'd practiced. "You look like you didn't sleep." "I slept fine." "You always say that." He studied her the way old soldiers studied people, quick and unbothered by manners. "You got that look my daughter gets before she goes skydiving, like part of you's already somewhere else." "It's just Tuesday, Walt." "Sure it is." He let it go, because that was the kind of man he was, the kind who noticed things and mostly kept them to himself unless asked. "Tell your old man I said hello, next time you see him." "I will." She didn't tell Walt that she'd see her old man that same afternoon for lunch, that he'd promised to bring her the good coffee from the roaster near his house, the one that didn't taste like hospital sludge. She didn't tell him that Daniel Hale had spent the whole weekend planning a dive trip to Blackwater Point that she'd told him. More than once, sounded like a bad idea for a 71-year-old man with a knee that clicked on stairs. He'd laughed at her, told her the ocean didn't care how old a man's knee was. At 8:52, her phone buzzed in her scrub pocket. A text from her father. Went diving this morning at Blackwater Point. Feeling weird. Probably nothing. Emily's stomach dropped before her mind caught up to why. Blackwater Point. 60 feet of cold water. Strong current. A wreck dive that even experienced divers treated with respect. Her father was 71 years old. Still strong. Still stubborn. Still convinced that 30 years in the Navy meant his body didn't age like everyone else's. She typed back. Define weird. No response. She stared at the phone for 11 seconds, then put it in her pocket and told herself he was probably just tired. Older divers got tired. That was normal. That wasn't an emergency. She told herself that for exactly 40 minutes. Master Chief Daniel Hale, retired, though nobody who knew him ever called him former anything, had found Emily 11 years old, sitting outside a shelter in Norfolk, refusing to go inside because the last shelter had let a man walk off with another kid's shoes, and nobody had stopped him. She didn't trust walls. She didn't trust people who smiled too easily. Daniel had crouched down to her eye level, which nobody ever did, and said, "You don't have to trust me. You just have to let me buy you a sandwich." She'd let him buy the sandwich. It took another 2 years before she let him buy anything else. A bed, a name on a school roster, a chance. He never told her what he'd done in the Navy. Not really. Just that he'd worked on boats, and that some of his friends had bad dreams sometimes, and that's okay. Dreams don't mean anything's wrong with you. She remembered the first year clearly, in fragments the way children remember things. The sound of his truck door, the smell of the motor oil on his jacket, the way he never raised his voice even when she broke things on purpose, to see if he'd finally give up on her. He never gave up. He fixed what she broke, and never once mentioned it again. She was 17 before she learned what SEAL Team meant. She was 20 before she understood what he carried behind the joke that nothing ever bothered him. She found the box in his closet by accident, looking for a spare fuse, a folded flag, a set of photographs with faces blacked out by the government before release, a citation with half its lines redacted. He caught her looking and didn't ask her to put it back. He just sat down next to her on the floor and told her, in pieces, the parts he was allowed to tell. He'd taught her to read water like other people read a room. Currents, temperature changes, the difference between a swell that would pass and a swell that would pull you under. He'd never once told her it would matter beyond the beach. It mattered more than he knew. At 9:15, Priya found Emily restocking the crash cart in Bay 2, moving with the particular efficiency of someone who needed her hands busy more than the task needed doing. "You okay?" Priya asked. "You've checked your phone like 6 times. My dad went diving this morning. Said he felt weird after. Hasn't texted back. Probably just seasick," Priya offered. "My uncle gets like that every time he's on a boat." "Probably," Emily said, though something in her chest didn't believe it. The particular unease of a person trained to notice small wrong things before anyone else does. At 9:31, the radio at the nurse's station crackled. "Trauma incoming, 5 minutes out, male, 71. Diving incident. Altered mental status, slurred speech, unilateral weakness, vitals unstable." Emily's hands went still on the chart she was holding. 71. Diving. She told herself there were other 71-year-old divers in the county. She told herself it didn't have to be him. She checked her phone. No new messages. Her chest tightened in a way she recognized and hated. The particular fear of a person who has been trained to stay calm in emergencies and knows exactly what that calm is costing her right now. "Hale, you good?" Priya asked, noticing the pause. "Fine," Emily said. "Get Bay 2 set up. Full trauma protocol." She moved on instinct, pulling gloves, checking the crash cart, setting up suction. Her hands doing the job while her mind ran somewhere else entirely. Somewhere 6 years in the past. Somewhere cold and dark and full of water she couldn't see through. Reyes strode past, clipboard in hand, glancing at the monitor bank without slowing down. Diving incident, elderly male. Probably a cardiac event that triggered the dive emergency. Get me a 12 lead the second he's through the door. "Copy," Emily said, though something in her had already begun sorting through a different list of possibilities entirely, one Reyes had never been trained to consider, because Reyes had never spent a single hour of his life underwater, with someone else's oxygen supply strapped to his back. The ambulance doors burst open at 9:38. 71-year-old male, found unresponsive at the dive site, brought up by his dive buddy. GCS 13 on scene, dropped to 11 in transit. Right-sided weakness, slurred speech, complaining of joint pain before he lost coherent speech. Emily looked at the gurney. Daniel Hale's eyes were half open, unfocused, his lips moving without sound. His right hand trembled against the rail. The wetsuit had been cut away from his chest, leaving him in a hospital gown 2 sizes too big. His broad shoulders, the shoulders that had carried her out of a shelter and into an entire life, sagging against the pillow like something had been let out of them. For exactly 1 second, Emily Hale was 11 years old again, sitting on a curb, waiting to see if this was another adult who would disappear. Then the trauma nurse in her took over, because that was the only way she knew how to survive the next 5 minutes. "Move him to Bay 2, she said, her voice flat and clear. "I've got him." Priya's eyes went wide as the paramedics wheeled the gurney past. Emily, is that—" "Not now," Emily said, already moving alongside the gurney, her hand briefly finding Daniel's uninjured wrist, checking his pulse without thinking, the way her fingers had checked 100 pulses in 100 worse places than this. Rapid, thready, not good. The dive buddy, a heavy-set man named Kurt who'd been Daniel's dive partner for 11 years, stood frozen near the doors, still in his wetsuit, dripping onto the tile. "He surfaced too fast," Kurt said, to nobody and everybody. "There was a current, we got separated near the wreck, and by the time I found him, he was already coming up too fast and I couldn't stop him. I couldn't get to him in time to slow him down." "How fast?" Emily asked, sharp, already knowing the answer mattered more than anyone else in the room understood. "Fast. Real fast. Maybe 30 feet in under a minute." Emily's stomach turned to ice. 30 feet in under a minute, after what had likely been at least 2 dives that morning based on Daniel's usual routine at Blackwater Point. That was more than enough for nitrogen to load into tissue and blood far faster than his body could safely release it on ascent. She said nothing to Kurt. There was no time, and there was nothing he could do now except stand out of the way. Reyes was the attending on shift. He looked at Daniel's chart, then at the monitor, then back at the chart. The way a man looks at a crossword he's already decided he can solve. Right-sided weakness, altered mental status, slurred speech, 71 years old. He said it like he was reading it off a textbook page. "This is a stroke. Classic presentation. Get me a CT stat. Start him on the stroke protocol." "He was diving," Emily said. "I heard that. Doesn't change the presentation." "It changes everything about the presentation." Reyes looked at her the way he'd looked at her all morning, like she was a piece of equipment that had started making noise it shouldn't be making. "Nurse Hale, I appreciate your enthusiasm, but I have an MD. Get the CT ordered." Emily's hands were steady on Daniel's IV line, but something under her ribs had gone tight and cold. She looked at the monitor. Heart rate elevated, oxygen saturation borderline, joint pain reported before he lost clear speech. That detail sat in her mind like a struck match. "Dr. Reyes, can I speak to you for 1 moment?" "We don't have a moment. Get the CT." "He surfaced too fast," Emily said, low enough that only Reyes and Priya could hear. "His dive buddy said it was an emergency ascent. If there was any nitrogen loading from repeated dives this week, an uncontrolled ascent can push nitrogen bubbles into his bloodstream and his central nervous system. That can absolutely mimic a stroke. It's called decompression sickness. If you send him to CT and it comes back clean, you've burned 20 minutes he doesn't have, and thrombolytics, if you gave them, could kill him." Reyes stared at her for a long moment. Something in his expression flickered, uncertain, then hardened back into confidence, because uncertainty wasn't a face he liked wearing in front of a nurse. "That's not a real diagnosis you're going to make in a trauma bay," he said. "Get the CT." "Sir, that's an order, Nurse Hale." Emily looked at Daniel. His eyes found hers for half a second, unfocused, searching. His mouth moved. No sound came out except a breath. She had 6 years of training telling her exactly what was happening in his bloodstream right now. She had 3 years of practice telling her exactly what would happen to her job if she said so out loud, again, in front of witnesses. She swallowed both truths and stepped back to get the CT ordered, because there was no version of this morning where disobeying a direct order helped him faster than finding another way. Find another way, she told herself. You always find another way. The transport tech, a broad-shouldered man named Ellis, who had wheeled 1,000 patients down this same hallway, glanced at Emily as they moved Daniel toward imaging. You know this guy? He's my father, Emily said, and saying it out loud in the hallway to a stranger felt like setting down something heavy for exactly 1 second before she had to pick it back up. Ellis didn't say anything else. He just pushed a little faster. In the CT suite, the tech ran the scan in under 6 minutes. Standard protocol. No complications. Emily stood behind the glass, arms crossed over her chest, watching the gray shapes of her father's brain scroll past on the monitor, praying to a god she wasn't sure she still believed in, that the machine would find nothing, and understanding, in the same breath, that finding nothing would only prove her right about something far more dangerous than a stroke. 21 minutes. That's how long it took to get Daniel to CT, get the images read, and bring him back to Bay 2 with a scan showing nothing. No bleed, no clot, no infarct. Clean brain, clean scan. A man getting worse by the minute with a piece of paper that said there was nothing wrong with him. CT's negative, Reyes said, sounding almost disappointed, like the machine had failed to confirm what he already believed. Because it's not a stroke, Emily said. Then what is it, Nurse Hale? Reyes's voice had an edge now, sharp with the particular anger of a man who has just been shown to be wrong in front of an audience and hasn't decided yet whether to admit it. Emily looked at the monitor. Daniel's oxygen saturation had dropped 2 more points. His right leg had started to twitch, a small tremor traveling up from his ankle. Decompression sickness. Type 2, neurological. Nitrogen bubbles in his blood and spinal fluid. He needs hyperbaric oxygen therapy, immediately, and IV fluids to help clear the nitrogen. Every minute we don't recompress him, those bubbles do more damage. There's no hyperbaric chamber in this hospital. There's one 40 minutes away at Coastal Regional. I already checked. Reyes's jaw tightened. You already checked. I checked 10 minutes ago, sir, while you were reading his scan. Something passed over the room, Priya's eyes widening slightly, another nurse near the doorway going very still. The particular silence that happens when a junior person has just proven the person in charge wrong for the second time in 1 hour. I am not transferring a patient 40 minutes based on a nursing hunch, Reyes said. We treat what's in front of us. Supportive care, admit to neuro, monitor overnight. He doesn't have overnight. That's not your call to make. A second-year resident named Foster, who had been shadowing Reyes since 7 that morning, cleared his throat from the doorway. Actually, Dr. Reyes, decompression illness with neurological symptoms is a real differential. It was covered in our emergency medicine rotation. If there's a dive history... Nobody asked you, Foster, Reyes snapped, and the younger resident went quiet, retreating half a step. The particular retreat of somebody who has just learned exactly how much his opinion counts in this room. Emily didn't look at Foster, but she filed the moment away anyway. Not everyone in that room was choosing to be blind on purpose. Emily looked at Daniel. His right hand had gone still against the rail. His breathing had changed, shallow, faster, working harder for less air. Somewhere behind her ribs, a version of herself she hadn't let out in 3 years began to stand up. Sir, at least let me start him on high-flow oxygen and aggressive IV fluids while we figure this out, Emily said, forcing her voice level. That's standard of care for suspected DCS, and it won't hurt him if I'm wrong. Fine, Reyes said, if only to end the conversation. High-flow oxygen, fluids at maintenance rate, that's it. Maintenance rate isn't aggressive enough. That's the order, Nurse Hale. Emily set the flow rate exactly where he told her to, and hated every second of doing it, because she knew, with the certainty of 6 years spent watching this exact condition unfold in worse places than a hospital bay, that maintenance rate wasn't going to be enough to slow what was coming. At 10:14, Daniel Hale's oxygen saturation dropped to 88%. His right side seized, a brief violent tremor that ran from his shoulder to his fingers. His eyes rolled back for 2 full seconds before returning, glassy, searching. Sat's dropping, Priya said, voice climbing toward panic. He's seizing. Push lorazepam, Reyes said. Get respiratory down here. We may need to intubate. Intubating him puts more pressure on compromised lung tissue if there's nitrogen embolism, Emily said, already moving. already at the head of the bed, her hands finding Daniel's face, tilting his chin, checking his airway with the same motion she'd used 100 times in open water, on strangers, on people she'd never see again. You intubate him now, and if I'm right about the diagnosis, you've made his prognosis worse, not better. I need you to step back from my patient. He's not just a patient. The words came out before she could stop them, low and cracked in a way her voice never sounded in a trauma bay. Reyes blinked. Excuse me? Emily didn't answer. She was looking at Daniel's face. Really looking. Past the oxygen mask fogging with each shallow breath. Past 3 years of careful distance she'd built brick by brick in this exact hospital. His hand twitched. Not a seizure this time. A reach. His fingers found her wrist. Weak. Trembling. But deliberate. His lips moved. No air behind the words. But Emily had spent 6 years reading lips through dive masks. Through storms. Through the particular silence of 40 feet of black water where sound didn't travel, and every word had to be read, not heard. "M-bird," he mouthed. The call sign only he had ever used for her, from the day she'd first jumped off a 40-foot platform into open water without hesitating, the day he'd said she flew instead of fell. Nobody in that trauma bay had heard that name in 11 years. Emily's throat closed. "Priya," she said, and her voice had changed. Quieter, but with something underneath it that made the younger nurse straighten without knowing why. "Get me the rebreather mask, not the seizure protocol, and call Coastal Regional. Tell them we have a Type 2 DCS case, and we need the chamber prepped in 35 minutes. You do not have the authority to call another facility," Reyes snapped. "Then I'll use my own phone," Emily said, already dialing. "Coastal Regional Hyperbaric Unit, this is Dana. Dana, this is Emily Hale, trauma nurse at Coastal Ridge VA. I need to speak to whoever's running your chamber right now. I have a 71-year-old male, Type 2 decompression sickness, neurological symptoms, declining oxygen saturation, right-sided motor involvement. I need the chamber prepped, and I need transport authorized in the next 10 minutes. There was a pause on the line. The particular pause of someone deciding whether the person calling knows what they're talking about. "Ma'am, transfers for hyperbaric usually come through attending physician orders." "I know. I'm telling you what's coming whether the order's signed yet or not, because in 20 minutes it won't matter what paperwork exists if his brain's been without proper perfusion that long. Ask for Dr. Osei if she's on. Tell her rescue swimmer Hale needs the chamber." Another pause. Longer this time. "Rescue swimmer Hale?" "She'll know what that means." Emily hung up before Dana could ask anything else, because she didn't have an explanation ready for the question she could feel coming, and because right now, the only thing that mattered was 35 minutes and a chamber that could push nitrogen bubbles back into solution before they did permanent damage to her father's brain and spine. Behind her, Reyes had gone very quiet. "What did you just say to them?" he asked. Emily didn't answer. She was back at Daniel's side, checking his pulse against her own watch, counting silently, her lips moving with the numbers the way she'd been trained to count in cold water when panic made time feel unreliable. "Nurse Hale, what did you just say to them?" "I told them what he needs. You gave them a call sign." Emily looked up. Reyes's face had shifted, the confidence cracking at the edges, replaced by something more careful. Behind him, Priya and 2 other staff members had stopped moving entirely, watching. Foster, the second-year resident, stood near the supply cart, a half-unwrapped IV kit forgotten in his hands. "Rescue swimmer," Reyes said slowly, like he was testing the shape of the words. "That's Coast Guard. That's not a nursing term." "No," Emily said. "It's not." Daniel's grip on her wrist tightened, weak but insistent. His eyes had cleared slightly, fighting through the fog of falling oxygen and rising nitrogen to focus on her face. The word came out cracked, barely air. "You remember. The platform." "I remember," Emily said, and her voice broke in a way it hadn't broken in front of anyone in 11 years. "I remember everything you taught me." "Then swim," Daniel breathed. Don't sink for me." Emily closed her eyes for exactly 1 second. When she opened them, something in her posture had changed. Small, but unmistakable to anyone who knew what they were looking at. Her shoulders squared, her spine straightened. The nurse who spent 3 years making herself smaller in every room she entered was gone. Replaced by someone who had once pulled 6 people out of a collapsing oil platform in a Category 3 storm and lost none of them. "Priya," she said, and her voice carried now, clear and level, the exact tone of someone used to being obeyed in an emergency. "I need 100% non-rebreather on him, not the mask he's on. I need 2 large-bore IVs, aggressive fluids, normal saline wide open. I need someone on the phone with Coastal Regional confirming ETA on transport, and I need it in the next 90 seconds. You don't give orders in my trauma bay," Reyes said, but his voice had lost its certainty. "Then give the order yourself," Emily said, turning to face him fully. "Because I've spent 6 years pulling divers out of the exact condition your patient is in right now, and I am telling you, doctor to doctor, that if you keep treating this as a stroke, he will be paralyzed or dead within the hour." The room went silent. Somewhere down the hall, a monitor alarm chirped once and went quiet, as if even the machines had decided to wait and see what happened next. 6 years, Reyes repeated. "As a nurse?" "As a Coast Guard rescue swimmer," Emily said. "Petty Officer First Class Emily Hale, retired. 6 deployments, 41 confirmed open water rescues, 200 hours of hyperbaric and dive medicine training that I have kept current every single year I've worked in this hospital, quietly, because nobody here ever needed to know until right now." Priya's hands had stopped moving over the IV kit, frozen mid-motion. "That man in the bed," Emily continued, and her voice cracked again, just slightly, "is Master Chief Daniel Hale. United States Navy, retired, SEAL Team 4. He found me sitting outside a homeless shelter when I was 11 years old, and he adopted me 18 months later. He taught me everything I know about water, about pressure, about staying calm when everyone around you is panicking. He is not a stroke case to me. He's my father. And I am telling you what he needs, because I have done this before, in worse conditions than a hospital trauma bay. And I have never once lost someone I was trying to save when I was allowed to do my job." Nobody moved for 3 full seconds. Foster was the first to react. He set down the IV kit and stepped forward. "Dr. Reyes, I've read her file. Not hers. I mean, I didn't know it was her, but there's a training bulletin that went out hospital-wide 2 years ago about staff with prior federal service, recommending we defer to specialized field knowledge in ambiguous presentations. I remember it because it used a Coast Guard case as the example. Reyes's jaw worked, caught between 2 versions of himself, the one who had spent 4 hours building his authority in this room, and the one now realizing exactly how much that authority was worth measured against 6 years of open water rescue experience. Then Reyes, to his credit, straightened his shoulders and said, in a voice much smaller than the one he'd been using all morning, "Non-rebreather, wide open fluids, get Coastal Regional back on the phone, now." The trauma bay erupted into the particular fast, coordinated motion of a team that has finally been given the right orders. Priya swapped the mask in 8 seconds flat. A second nurse threaded the new IV line into Daniel's left arm without being asked twice. Ellis, the transport tech, appeared at the doorway already pushing a gurney, as if he'd known before anyone told him that they'd be moving fast in the next few minutes. Emily turned back to Daniel, whose eyes had drifted half-closed again, his breathing shallow but steady enough. She took his hand, the one with the tremor, and held it the way he had once held hers on a curb outside a shelter, 17 years ago. "I've got you," she said. "I promise. I've got you." Reyes lingered near the foot of the bed for a moment longer than he needed to, watching her work, watching the precision in her hands that had nothing to do with 3 years of nursing school, and everything to do with a version of her life he hadn't known existed an hour ago. "Hale," he said, quieter now, "is there anything else I should know before transport gets here?" "Yes," Emily said, not looking up from the IV line she was securing. "Whatever you write in that chart, write it accurately. He surfaced too fast after multiple dives. This is decompression sickness until proven otherwise. And if Coastal Regional's team asks you anything, tell them exactly that, so nobody there wastes the 20 minutes I already wasted here." Reyes flinched at that, but he didn't argue. He picked up the chart and started writing, his handwriting noticeably less confident than it had been an hour before. Behind her, the trauma bay had settled into the low, urgent hum of a well-run emergency. Orders shouted and answered, equipment wheeled in, the machinery of the hospital finally moving at the speed Daniel Hale's body needed. And underneath all of it, for the first time in 3 years, Emily Hale stood in that room exactly as tall as she actually was. The transport team from Coastal Regional arrived in 18 minutes, not 35, because Emily had called Dr. Osie's personal line the moment she hung up with the front desk, and Dr. Osie had not asked a single question once she heard the name Rescue Swimmer Hale. 2 paramedics wheeled a portable chamber-ready gurney through the trauma bay doors. Reyes stood back near the nurse's station, arms crossed, watching Emily work with the particular stillness of a man recalculating everything he thought he understood about the last 4 hours. "Vitals for transport," the lead paramedic said. "Sats holding at 91 on the non-rebreather," Emily answered without looking up. "Heart rate 108, BP 140/88, GCS back up to 14 since the fluids went in. Right-sided weakness improving but still present. He needs the chamber within the hour or that improvement reverses. You called this in as Rescue Swimmer Hale," the paramedic said, studying her for a second longer than necessary. "You worked out of Station Cortez?" 6 years, sector command before that." The paramedic's expression shifted, something between recognition and respect. "I heard about the Cortez oil platform rescue 4 years back. That storm that took out the North Crane." 5 people, Emily said quietly. "Not 4. We lost one. You didn't lose him. The storm did." Emily didn't answer that. She had spent 6 years telling herself the same thing, and had never quite believed it on the nights it mattered. They loaded Daniel onto the transport gurney. His eyes found Emily's as they wheeled him toward the doors, his right hand twitching against the strap, still weak, but reaching for her. "Riding with him," Emily said. It wasn't a request. "Nurse Hale, you're on shift," Reyes started. "I'm using my break. Actually, I'm using every break I have coming to me for the next month. Priya can cover Bay too." Reyes opened his mouth, then closed it. Something in his face had changed since the seizure, since the phone call, since watching a woman he'd spoken to like a child for 4 hours turn out to have pulled 41 people out of open water with her bare hands and a rescue line. He didn't apologize. Not yet. But he stepped aside and let her go. "Hale," he said as she passed him. "For what it's worth, I'm glad you didn't listen to me." Emily didn't answer. There wasn't time, and there wasn't room in her chest for anything except the next 22 minutes. The ambulance ride took 22 minutes. Emily sat beside the gurney, one hand on Daniel's wrist, monitoring his pulse the old-fashioned way. The way she'd learned before she ever trusted a machine to tell her the truth about a body in crisis. The second paramedic, a younger man who introduced himself only as Danny, kept glancing at her between checks on the monitor, the particular sideways attention of someone trying to place a face, but said nothing, giving her the quiet she needed. "You lied to them," Daniel said, his words slurred but clearer than before. Oxygen and fluids doing their slow work. "Said you kept your training current, quietly. I did keep it current. For 3 years, in secret. While you let some kid in a white coat talk to you like you didn't know the difference between a stroke and a bubble in the blood. I needed the job to be simple, Dad." The word came out before she thought about it. Dad, not Daniel, not Master Chief. The word she'd used since she was 14, and finally let herself believe he wasn't going anywhere. I needed one place where nobody expected me to be the person who pulls bodies out of collapsing platforms. Just a nurse. Just scrubs and a badge and going home at the end of a shift without dreaming about water. That storm wasn't your fault. I know that, Emily said, and her voice cracked on the second word. Knowing it and believing it aren't the same thing. Daniel's hand found hers, weak but certain. You found me a sandwich kid on a curb who didn't trust doors, and I never once made you go back inside a room you didn't want to be in. I'm not going to start needing you to be someone you don't want to be now either. But Emberd, you don't drown quiet. You never did. That's not who I raised. The ambulance rocked over a pothole. Machines beeped their steady rhythm. Emily looked at the man who had built an entire life around a girl who used to sit on curbs, and let herself, for just a moment, be exactly as frightened as she actually was. I don't know how to stop being scared of losing you, she said. Good, Daniel said, eyes drifting closed again, his voice fading toward sleep. Means you love somebody enough to be scared. That's not weakness, kid. That's just what it costs to have people. Danny glanced between them, quiet now, giving them what privacy the small space allowed, checking the monitor one more time before settling back and letting the two of them have the moment without comment. At Coastal Regional, Dr. Osi was waiting at the ambulance bay doors personally, a woman in her 50s with silver-streaked hair pulled back in a knot, and the unmistakable bearing of someone who had spent decades around military medicine. "Rescue swimmer Hale," she said, extending a hand to Emily before the gurney had even cleared the doors. "Sarah Osi. I ran the dive medicine unit at Naval Medical Center Portsmouth for 11 years before I came here. I know your service record. Cortez platform, Category 3, 5 souls, 1 lost to structural collapse, not to rescue failure." I read the incident report. Emily's throat tightened. "You read it. Every rescue swimmer's file who transfers a patient to my chamber gets read once I hear the call sign," Osei said. "I don't hand my chamber over to a hunch. I hand it over to competence. You called this exactly right, and you called it fast enough that he's going to walk out of here instead of being carried." "You don't know that yet." "No," Osei agreed. "But I know decompression sickness, and I know what an extra 30 minutes without treatment would have done to him, and thanks to you, we're not finding out." They moved Daniel into the chamber prep room. Osei ran through the treatment protocol with brisk efficiency. Extended oxygen table, 90 minutes at depth equivalent pressure, monitoring for symptom resolution, a second table if needed. A technician named Marcus, no relation to anyone Emily knew, ran through a checklist on the chamber itself, testing seals, confirming oxygen supply, logging pressures with the calm repetition of someone who had done this 1,000 times and respected it every single time regardless. "You should rest," Osei told Emily, gesturing to a chair outside the chamber viewing window. "This part takes hours. You did your job. Let me do mine." Emily sat. She did not rest. She watched through the small round window as the chamber door sealed, as the pressure gauge began to climb, as the man who had taught her to read water disappeared into a steel tube built to push poison back out of his blood, one atmosphere at a time. She thought about the platform, the storm, the 5th rescue, the one she hadn't made in time, the one that still visited her most nights as black water closing over a face she couldn't reach fast enough. She thought about the debrief afterward, the way command had called it an acceptable loss in a room full of fluorescent light, the way nobody in that room had asked her what it felt like to hear an order to surface while a man was still somewhere beneath her, alive, for at least a few more seconds than they gave her credit for believing. She thought about 11 years old, sitting on a curb, and a man who hadn't smiled too easily, who had crouched down instead of talking down. She did not cry. Rescue swimmers didn't cry on duty. But she let her shoulders shake, once, in the quiet hallway, before she pulled them back into the posture Daniel himself had taught her. Spine straight, chin level, eyes forward, because a swimmer who couldn't hold her own posture couldn't hold anyone else's weight either. Osi sat down beside her without asking permission. The particular ease of someone who had comforted 100 frightened family members and knew exactly how much space to give and how much to close. "You don't get to keep the wins without carrying some of the losses too," Osei said quietly, eyes on the chamber window. "Nobody signs up for the good parts only." Emily said nothing, but something in her chest loosened, just slightly. Back at Coastal Ridge, word had already moved through the hospital the way it always does. Not through any announcement, but through the particular electricity of people repeating something they can't quite believe. By early afternoon, 3 separate nurses had stopped Priya in the hallway to ask if it was true. A respiratory therapist who'd been in the room during the seizure had already told the story twice, embellishing Emily's exact words each time, though the truth needed no embellishment. Reyes sat alone in the physician's lounge, staring at Daniel Hale's chart, rereading his own initial notes. Suspected CVA. Recommend CT, stroke protocol, neuroconsult. Every word of it wrong, and wrong in a way that would have cost a man his mobility, possibly his life, if the nurse he'd dismissed twice in one morning hadn't overridden him with a diagnosis she wasn't technically licensed to make, and was, in every way that mattered, completely correct about. He thought about the 6 years of medical school, the residency, the letters after his name. He thought about the woman in bright blue scrubs who had spent 6 years finding people in water, dark enough to swallow a flashlight beam whole, and had never once put those years on a resume anyone in this building had seen. Foster stopped by the lounge doorway, hesitant. "You good, Dr. Reyes?" No, Reyes admitted, which surprised them both. I almost killed a man today because I decided a nurse couldn't possibly know something I didn't. For what it's worth, most attendings wouldn't have admitted that. Most attendings didn't have a former special operations medic standing in their trauma bay this morning, Reyes said. I got lucky. He didn't get lucky. He got saved, despite me. Not because of me. That's a hard thing to sit with. Around 2:01 p.m., Reyes found Priya at the nurse's station. When she comes back, he said, tell her I want to talk to her. Not as her attending. Just... He stopped, searching for the right word. Just as somebody who owes her an apology and wants to understand what he almost did. The call came into Coastal Ridge at 4:40 p.m., relayed through hospital security to the charge nurse, then straight to Reyes, because the man who'd dropped it had specifically asked for whoever was overseeing Daniel Hale's case. There's a man in the parking structure, security reported. Says his name's Walsh. Says he served with the patient. Says he needs to see him immediately. He's got a firearm. Says he's licensed to carry, shows a permit, but he's agitated. Says something about a debt Hale owed him and a storm. Reyes's blood went cold. He called Emily's cell, the one number he had, because in 4 hours, she had become the only person in the hospital who might understand what was happening. Emily answered from the hallway outside the hyperbaric chamber, phone pressed to her ear, watching the pressure gauge through the small round window. Reyes, what's wrong? There's a man in our parking structure, armed. Says his name is Walsh. Says he served with your father. Says there's a debt tied to a storm. He's asking for Hale by name. Emily's stomach dropped through the floor. Walsh. She hadn't heard that name in 4 years. Petty Officer Second Class. Marcus Walsh had been the 5th rescue that night at the Cortez platform. The one the storm took, the one whose brother, Emily had learned much later, blamed the Coast Guard's decision-making that night, rather than the storm itself. Rescue Swimmer Command had prioritized the 4 survivors over a 5th man already presumed lost beneath collapsed scaffolding. Emily had fought that decision in real time, in the water, with a superior officer screaming into her earpiece to abandon the 5th man and surface before the platform came down entirely. She had obeyed the order. She had never forgiven herself for obeying it. And somebody, Marcus's older brother, a man named Grant Walsh who had left the service under a cloud 2 years before the Cortez incident, had apparently spent 4 years deciding that Daniel Hale, Emily's commanding contact in the after-action review, was the man responsible for the decision that killed his brother. He's not at Coastal Ridge, Emily said, already moving, already pulling her badge and scrub top straight. The same transformation happening in her spine that had happened in the trauma bay that morning. My father's at Coastal Regional, in hyperbaric treatment. If Walsh is looking for Hale and he's confused about the hospital... He's not confused, Reyes said. Security just radioed. He's asking specifically for Coastal Regional's location. He's headed your way. Emily's blood ran cold. How long ago did he leave? 6 minutes. Coastal Regional was 11 minutes from Coastal Ridge by road. Emily had roughly 5 minutes before an armed man carrying 4 years of grief and a grudge arrived at the same hospital where her father lay sealed inside a steel chamber, unable to move, unable to defend himself, utterly and completely vulnerable. Dr. Osei, Emily said, already running down the hallway. I need hospital security here now. Lockdown protocol on this wing. There's an armed individual en route with a personal grievance against my father. Osei didn't waste time asking questions. Within 90 seconds, hospital security had sealed the wing's secondary entrance and posted a guard at the primary hallway. Osei herself stayed at the chamber controls, monitoring Daniel's treatment, which could not be stopped or rushed without risking the exact neurological damage they were trying to prevent. He can't come out of that chamber early, Osei told Emily. Doing so risks reversing everything we've gained in the last 3 hours. If this man gets inside, he won't get past me, Emily said. You're a nurse, not security. I'm a rescue swimmer with 41 confirmed saves and a body that remembers exactly how to move when someone's life is in the balance. Lock the outer doors. I'll handle the inner hallway. Osei studied her for 1 long second, then nodded, because something in Emily's voice had made the decision for her. Try telling him that in the next 4 minutes, Emily murmured to herself, and pushed through the door. Grant Walsh came through the parking structure stairwell at 4:52 p.m., A man in his late 30s with the hollow-eyed look of someone who had spent 4 years feeding a single idea until it consumed every other thought he had. He wore a faded Coast Guard veteran's jacket, unzipped, a sidearm visible at his hip, his permit real, his intentions anything but lawful. Security had locked the main doors, but Walsh had studied the hospital layout online, had found the service corridor that connected the parking structure to the hyperbaric wing through an unmarked maintenance door, the kind of overlooked vulnerability that 4 years of obsessive planning eventually finds. Emily met him in that corridor, alone, having sent the one security guard back to cover the main entrance in case Walsh had a second approach planned. Fluorescent light hummed overhead, casting the narrow service hallway in the same flat white as every trauma bay Emily had ever worked, though this one smelled of cleaning solvent instead of antiseptic, and carried none of the comforting order of a room built for saving lives. "Grant," she said, and his head snapped toward her, recognition flickering across his face. "You," he said. "Rescue swimmer Hale. I remember you from the incident report. You were in the water with my brother." "I was," Emily said. "I tried to reach him. The platform came down faster than command predicted. I was ordered to surface. You left him." "I was ordered to leave him," Emily said, her voice steady, even as something inside her chest tore open at the words, 4 years of guilt rising up exactly where it always lived. "I have spent every night since wishing I'd disobeyed that order, but Master Chief Hale wasn't the man who gave it. He wasn't even on the platform that night. He ran the after-action review. He wasn't your brother's commanding officer during the rescue." "He signed off on it," Walsh said, his hand drifting toward his hip. "He's the one who called it justified, made sure nobody got charged, made sure the Coast Guard walked away clean while my brother's body stayed under that scaffolding for 6 days before they recovered him." Emily's mind ran fast, scanning the corridor. Fire extinguisher mounted on the wall 8 feet to her left, a crash cart left outside a supply closet 10 feet behind Walsh. No other personnel in the hallway, no clean angle for security to intervene without risking a shot fired in a hospital corridor. "Grant," she said, keeping her voice low, even, the exact tone she'd used talking down panicked survivors in open water. "I understand you've spent 4 years believing somebody owes you an answer for what happened to Marcus. I owe you that answer, not Daniel Hale. Me. I was the swimmer in the water. I made the call to surface. If you need someone to be angry at me. You're just trying to protect him." "I'm trying to tell you the truth," Emily said, taking one slow step forward, closing the distance by inches, watching his hand, watching his eyes, reading his body the way she'd read a diver in distress 100 times. The tremor in his fingers, the shallow rhythm of his breath. A man closer to breaking down than opening fire, if someone gave him a reason to choose the first over the second. Marcus was the best swimmer in our unit. I trained under him for 8 months before Cortez. I have his rescue technique tattooed into how I do this job to this day. I think about him every single time I go into open water, which is why I don't do it anymore except when I absolutely have to. He wasn't a name in a file to me. He was somebody I respected, and I have spent 4 years wishing I could trade what happened that night for anything else." Walsh's hand had stopped moving toward his weapon. His shoulders had begun to shake. "He was supposed to come home," Walsh said, and his voice cracked entirely, the fury draining out of it and leaving something rawer and sadder underneath. "He was 6 weeks from his discharge date. 6 weeks." "I know," Emily said. "I was there when they told his unit. Nobody ever apologized to me. 4 years. Nobody from the Coast Guard ever once looked me in the eye and said they were sorry." "I'm looking you in the eye right now," Emily said, close enough now to reach out, though she didn't, keeping her hands visible, open, unthreatening. "I'm sorry, Grant. I'm sorry I didn't reach him in time. I'm sorry you've carried this alone for 4 years, without anyone from my service telling you the truth of what happened that night. You deserved that conversation a long time ago. And I should have found you and had it myself instead of letting the file speak for what happened. Why didn't you? Because it was easier to disappear into a hospital and be nobody than to face what I couldn't fix," Emily said, and the honesty of it surprised her even as she said it. "That's the truth, Grant. I hid from this the same way I've hidden from everything about who I used to be. You're not the only one who spent 4 years running from that storm." Grant Walsh stood in that corridor, weapon still holstered, hand no longer reaching for it, and wept the way men weep when they have spent years being too angry to grieve properly, his shoulders shaking, his knees nearly buckling until he leaned back hard against the corridor wall to stay upright. "I don't even know what I was going to do," he said, voice raw. "I got in my car this morning and I needed somebody to answer for it. I needed it to matter to somebody besides me. It matters to me," Emily said. "It's mattered to me every single day for 4 years. I promise you that." Security reached them 30 seconds later, disarming him without incident, because by the time they arrived, Walsh had already surrendered the only fight he'd come there to have. An officer read him his rights in a voice gentler than procedure required, and Walsh went without resistance. His head down, his jacket collar damp with tears, he made no effort to hide any more. Emily stood alone in the corridor afterward, breathing hard, her hands finally shaking now that there was nothing left to hold steady for. O.C. found her there 2 minutes later and said nothing, just put a hand briefly on her shoulder before walking her back toward the chamber viewing window, where the pressure gauge still read steady, where Daniel Hale, unaware of everything that had just happened 20 feet from where he lay sealed in oxygen and silence, was still fighting his own private battle against the nitrogen in his blood. Grant Walsh was taken into custody without further incident. He did not resist. When the officers asked him what he'd intended to do, he said only, "I don't know anymore." And Emily believed him, because she had seen exactly that moment before. The point where 4 years of grief finally ran out of road and had nowhere left to go but down. Daniel Hale's hyperbaric treatment finished at 7:15 that evening. When the chamber door opened, he was pale, exhausted, but alert. His right-sided weakness reduced to a faint tremor in 2 fingers that Dr. O.C. assured Emily would likely resolve completely within days. "You're going to live," Emily told him, her voice thick, standing at the edge of the recovery bed. "Told you I would," Daniel said, his words clear now, steady. "Never doubted it for a second. You scared me. You scared a man with a gun into surrendering peacefully in a hospital hallway," Daniel said. "I think we're even." Emily laughed despite herself, a sound half sob, half genuine relief, and sat down heavily in the chair beside his bed. "I heard some of it," Daniel said quietly. "Osei told me. About Walsh. About what you said to him. I told him the truth." "You told him the truth that was yours to give," Daniel said. "Not mine. You've been carrying Cortez alone for 4 years, the same way you've been carrying being a rescue swimmer alone for 3, hiding it in a hospital where nobody knew what you actually were. Maybe it's time you stopped doing both." Emily looked down at her hands, at the rope scars across her palms, pale lines she'd stopped noticing years ago, because noticing them meant remembering what put them there. "I don't know how to be both people at once," she admitted, "the nurse and the swimmer. I've spent 3 years keeping them in separate rooms in my head, because when I let them share space, all I can see is Marcus Walsh under that scaffolding, and Grant standing in a hallway with a gun, because nobody ever gave him anything better to carry than rage. You don't have to know how yet," Daniel said. "You just proved today you can do both when it matters. The rest is practice. Same as learning to read water. Nobody's born knowing how. You just keep showing up to the beach until your body remembers before your mind catches up." A nurse from the hyperbaric unit, not Priya, a coastal regional staffer named Renata, came by to check vitals, and on her way out, paused at the doorway. "For what it's worth," Renata said, "half the unit's already heard what you did today. Osei doesn't usually let outside personnel call shots on her chamber schedule. She let you, because apparently your reputation walked in ahead of you." "My reputation hasn't walked anywhere in 6 years," Emily said. "Reputations don't need feet," Renata said, smiling, and left them alone. 2 days later, Daniel was discharged with a full neurological recovery and instructions to avoid diving below 30 feet for at least 6 months. Emily drove him home herself, Coastal Ridge behind her, the hospital corridors already buzzing with a story that had grown 3 sizes since the morning it happened. Reyes found her before she left, standing awkwardly near the staff exit with his hands in his coat pockets. "I owe you an apology," he said. "Several, actually. I dismissed your assessment 4 times yesterday. If you hadn't overridden me, hadn't called Coastal Regional yourself, hadn't stood your ground when I ordered you to step back. He doesn't walk out of this hospital. He doesn't walk at all, maybe. I need to sit with that. You will, Emily said. That's the job. You'll be wrong again someday, and you'll learn something from it, or you won't be worth much as a doctor. The difference is whether you listen next time someone with more field experience than you tells you what they're seeing. I will, Reyes said, and for the first time in 4 years of working together, he meant it without performing it. There's something else, Reyes added before she could turn away. Foster mentioned a training bulletin, something about deferring to specialized field knowledge. I looked it up after you left yesterday. It exists, but it's 3 paragraphs buried in an onboarding packet nobody reads twice. That's not a policy. That's a formality nobody enforces. I know, Emily said. That's part of why I almost lost him yesterday. There's something else, Emily added. I've been thinking about it since yesterday. This hospital doesn't have a real protocol for recognizing field-trained personnel who move into civilian medicine. No pathway for cross-training staff on tactical trauma assessment, dive medicine, hyperbaric recognition, mass casualty triage from a combat or maritime perspective. We have 3 veterans on this nursing staff alone with specialized field training that nobody's ever asked about because the assumption is always civilian nursing school and nothing more. What are you proposing? A program. Structured training for ER and trauma staff on recognizing field-specific presentations, dive injuries, blast injuries, combat pattern trauma, taught by veterans already on staff who know it firsthand. I'd run it. I've got 6 years of training I've been keeping quiet, and yesterday proved exactly what it costs this hospital when that knowledge stays hidden. Reyes considered her for a long moment, something like respect settling into his expression where uncertainty had lived the day before. I'll take it to administration myself, he said. You'll have my full support. You mean that? I almost lost a man because I trusted a fresh CT scan over a nurse's field diagnosis, Reyes said. I'll mean anything that makes sure that never happens again, on my shift or anyone else's. 3 weeks later, Emily stood at the front of a small conference room at Coastal Ridge. 12 staff members seated in front of her, nurses, 2 residents, a respiratory therapist, and Reyes in the back row, notebook open, listening the way a student listens, rather than the way an attending pretends to. On the wall behind her hung a simple banner, hand-lettered by Priya, Coastal Ridge Tactical and Field Medicine Program. Founding instructor, E. Hale, rescue swimmer, USCG, retired. Decompression sickness, Emily began, is frequently misdiagnosed as stroke in emergency settings because the neurological presentation can look identical without a proper dive history. I want to walk you through exactly what to look for, what questions to ask, and why 30 extra minutes of the wrong treatment can cost a patient permanently. She walked the room through the mechanism first. Nitrogen loading in tissue during repetitive dives, the danger of rapid ascent, the way bubbles could lodge in the spinal cord or brain and produce symptoms indistinguishable from a cerebrovascular event to an untrained eye. She showed them the dive history questions that should be standard in any triage involving water exposure. She talked about hyperbaric referral windows, about the cost of hesitation, about the difference between a scan that shows nothing and a diagnosis that is, in fact, nothing. Foster raised his hand near the end. How do you carry it? Knowing what you know, and having to wait for permission to act on it. Emily considered the question longer than she'd expected to. Some days you don't carry it well, she admitted. Some days you go home and you sit in your car in the driveway for 20 minutes before you can make yourself go inside, because you spent the whole shift being smaller than you are, so nobody would ask you a question you didn't want to answer. I did that for 3 years. I'm not doing it anymore. That's really the only advice I've got that's worth anything. Stop making yourself smaller to keep other people comfortable, especially when somebody's life is on the line. The room was quiet for a moment, the particular quiet of people recognizing something true. After the session, as the room emptied, Daniel walked up to her, slower than he used to move, but steady. He'd asked to attend the first session, and Emily hadn't had the heart to say no, even though watching him nearly die 3 weeks earlier still surfaced in her dreams some nights, cold and dark and reaching. 11 years old, he said, sitting on a curb, refusing to trust a single adult in that shelter. And now look at you, standing up in front of a room, teaching people things that could have saved your father's life, because you decided being seen was worth more than being safe. You taught me that, Emily said. Every lesson you ever gave me on that beach was really about this, About not sinking quiet, even when it's easier. I just taught you to read water, Daniel said. You taught me to read people too, Emily said. You taught me that the people who matter don't need you small to feel comfortable around you. Reyes needed a wake-up call before he understood that. You never did. Daniel put a hand on her shoulder, the same hand that had once crouched down to an 11-year-old's eye level outside a shelter and asked for nothing more than the chance to buy her a sandwich. Titles don't make character, M. Bird, he said. Character makes character. You had it long before the Coast Guard gave you a rank to put on it. Priya caught up with them in the hallway, grinning, holding a printed schedule. Administration approved 8 more sessions, and Foster asked if you'd consider a rotation for residents specifically. He said, and I'm quoting, that yesterday was the first time in 2 years of medical training he actually understood why humility matters in a trauma bay. Emily took the schedule, looked at the 8 new dates lined up across the page, and felt something settle in her chest that hadn't settled there in a long time. Not relief exactly, and not pride exactly, but something close to both. The particular feeling of a life finally fitting together the way it was supposed to. Respect isn't handed out with a badge or a title, Daniel said, watching her read the schedule. It's earned quietly, in the moments nobody's watching, and sometimes it takes almost losing everything to finally let the people around you see exactly who you've been all along. Emily folded the schedule and tucked it into her scrub pocket, next to her phone, next to the badge that had never once told the whole truth about who she was. And for the first time in 3 years, she didn't mind that people were starting to ask. The end. If this story moved you, you know what to do. Hit that like button, tell us in the comments where in the world you're watching from tonight, and subscribe so you never miss the next story on Secrets of Silent Badges. We'll see you in the next one.